Benign prostate enlargement, BPE, also known as benign prostatic hyperplasia, BPH, is a condition that affects older men and anyone with a prostate. It's particularly common in men and anyone with a prostate over 50 years of age and isn't usually a serious threat to health. Prostate gland. The prostate is a small gland, located in the pelvis, between the penis and bladder. It's involved in the production of semen. The prostate produces a thick, white fluid that's made into a thinner liquid by a protein called prostate-specific antigen, PSA. The liquid is then mixed with sperm, produced by the testicles, to create semen. If the prostate becomes enlarged, it can place pressure on the bladder and urethra, the tube through which urine passes. This can affect how you pass urine and may cause difficulty starting urination, a frequent need to urinate, difficulty fully emptying the bladder. In some men and anyone with a prostate, the symptoms are mild and don't require treatment. In others, the symptoms can be very troublesome and have a major impact on a person's quality of life. Read more about the symptoms of benign prostate enlargement. Many people worry that having an enlarged prostate means they have an increased risk of developing prostate cancer. This isn't the case. The risk of prostate cancer is no greater for people with an enlarged prostate than it is for those without an enlarged prostate. How is benign prostate enlargement diagnosed? If your GP suspects that you have an enlarged prostate, you'll be asked to complete a questionnaire to assess your symptoms. Each question has 5 possible answers that carry a score, and your overall score indicates the severity of your symptoms. Your GP will also want to rule out other conditions that cause similar symptoms to prostate enlargement. You may have a number of standard tests, such as urine tests, plus some more specific tests, such as a blood test that measures PSA. Treating benign prostate enlargement. Treatment for an enlarged prostate is determined by the severity of your symptoms. If you have mild to moderate symptoms, you won't receive any immediate medical treatment, but you'll have regular checkups to carefully monitor your prostate. You'll probably also be advised to make lifestyle changes, such as limiting your caffeine and alcohol intake, and exercising regularly, to see if they improve your symptoms. As well as lifestyle changes, medication is usually recommended to treat moderate to severe symptoms of benign prostate enlargement. Finasteride and dutasteride are medications that are commonly used. They block the effects of a hormone called dihydrotestosterone, DHT, on the prostate gland, which can reduce the size of the prostate and improve associated symptoms. Alpha blockers may also be prescribed. They help to relax your bladder muscles, making it easier to pass urine. Tamsulosin and alfuzosin are 2 alpha blockers commonly used to treat benign prostate enlargement. Surgery is usually only recommended for moderate to severe symptoms of benign prostate enlargement that have failed to respond to medication. Nursing Care Plan 1. Assess vital signs and monitor the signs of infection. To establish baseline observations and check the progress of the infection as the patient receives medical treatment. Administer the prescribed antibiotic for UTI. The antibiotic choice is based on the result of the urine culture and sensitivity test. The usual course of antibiotics for UTI runs for 7 to 10 days. To treat the underlying infection, obtain a urine sample for urinalysis once the antibiotic therapy has been completed. To confirm that the infection has been completely treated, or if there is a need to continue the same antibiotic therapy or shift to a different treatment. Teach the patient some lifestyle changes related to UTI prevention, including proper hygiene, adequate oral hydration, at least 2 liters of fluids per day, if not contraindicated, and avoidance of undergarments that have non-breathing materials or are constricting, tight-fitting. Good oral hydration results to more urine production, leading to flushing of bacteria from the bladder once the urine is eliminated. Undergarments that are made of non-breathing materials or are tight-fitting promote moisture formation. This encourages bacterial growth. Nursing Care Plan BPH 2. Nursing diagnosis. Impaired urinary elimination related to frequent urination and urgency secondary to BPH as evidenced by dysuria and urinary frequency. Desired outcome. The patient will be able to achieve normal pattern of urinary elimination. BPH nursing interventions. Rationales. Assess the patient's current pattern of elimination and compare with his/her normal pattern. To establish baseline data on urinary elimination pattern. Administer the prescribed medications for BPH, such as alpha-adrenergic receptor blockers, 5-alpha reductase inhibitors, and phosphodiesterase 5 enzyme inhibitors. To treat the underlying disease. Palpate the bladder and observe for bladder distension. To check for bladder distension and bladder retention. Encourage the patient to void every 2 to 3 hours. To facilitate flushing of bacteria from the bladder and avoid urine accumulation. Teach the patient some lifestyle changes related to UTI prevention, including proper hygiene, adequate oral hydration, at least 2 liters of fluids per day, if not contraindicated, and avoidance of undergarments that have non-breathing materials or are constricting, tight-fitting. Good oral hydration results to more urine production, leading to flushing of bacteria from the bladder once the urine is eliminated. Undergarments that are made of non-breathing materials or are tight-fitting promote moisture formation. This encourages bacterial growth. Nursing Care Plan BPH 3. Nursing diagnosis. Disturbed sleep pattern related to nocturia secondary to BPH as evidenced by verbalization of inability to sleep, delayed sleep onset, bladder pain or discomfort, frequent urination, restlessness, and irritability. Desired outcome. The patient will report an improved rest-sleep pattern and verbalize feeling well rested. BPH nursing interventions. Rationales. Assess the patient's current pattern of sleep and rest and compare with his/her normal pattern. To establish baseline data on rest-sleep pattern. Administer the prescribed medications for BPH, such as alpha-adrenergic receptor blockers, 5-alpha reductase inhibitors, and phosphodiesterase 5 enzyme inhibitors. To treat the underlying disease. Encourage the patient to limit oral hydration during nighttime. Advise the patient to avoid caffeine-containing drinks in the evening. To reduce urinary frequency during bedtime. Caffeine blocks sleep-inducing chemicals produced in the brain, thereby increasing level of alertness. Reduce sleep disturbance in the environment such as room temperature, noise and light. Provide comfort measures such as back rub, warm bath, and relaxation techniques. To provide a sleep-conducive environment.